Andrea Burns. I remember when I was a new mum feeling excited and thrilled and a little bit overwhelmed by all the advice I was given. There's a lot to take in, isn't there? Today we're going to give you some important information to help you make an informed decision about having your baby's hearing screened. When your baby's born, he or she will be screened for a range of conditions, mostly through a blood test. As you can see, hearing loss is by far the most frequently identified condition in newborns. But sophisticated equipment means it can now be easily picked up by a quick and painless test. Hearing loss is invisible. Around half of all babies with a confirmed hearing loss will have no risk factors. Without a screening test, your child could be 2 or even 3 years old before a hearing loss is found. But with this screening test, any hearing loss can be picked up straight away. The best outcomes for children come from early detection and early intervention. Early detection and early intervention offer the best chance for children to develop listening, speaking, and social skills. Many parents think they can self-test their baby's hearing, or that they'll just know if their child's hearing isn't normal. But don't be fooled. New babies have very subtle responses to sound, and a reaction such as being startled by a slamming door or loud noise doesn't always mean your baby can hear properly. Hearing loss can vary from mild to moderate to severe to profound and needs a professional diagnosis.
Well, we don't have any family history of hearing loss, so we didn't have Joshua's hearing tested at birth, but it did become apparent to us that he wasn't learning to talk normally, and so when he was about 4 we did end up having his hearing properly tested, and we found out then that he has a moderate hearing loss, which means that he can't hear normal speech. So whilst it was heartbreaking to discover that, it was also an enormous relief because it explained everything about his very significantly delayed speech and language development. I wish we'd known earlier. I wish I had had him tested at birth, and I urge everybody to have their babies screened at birth.
The only reliable way to check a baby's hearing is to test using specialised equipment. This equipment is reliable when your baby is just 6 hours old. A trained screener will perform this quick and non-invasive test in your room or on the ward, so you can have this important check done before you even take your baby home. Children with a hearing loss have difficulty learning to speak. From birth to 3 years is the most important time for your baby's brain to develop hearing, speech and language. Services for babies learning to listen and speak can be started at birth, so children have the best chance of developing normally. Let's look at this graph. It shows you that if your child's hearing loss was detected at birth, by age 3, he or she would understand 400 to 700 words. But see what happens if your child's hearing loss is not detected until 2 years of age. The number of words drops greatly.
Sophie is 7 and Hailey is 2.5. They both have a profound hearing loss. Sophie wasn't offered newborn screening, and so her hearing loss was quite hard to detect, and she wasn't picked up until she was about 2. I really wish that Sophie was offered the newborn screening test. It would have made a huge difference to her and also our family. It was quite hard to pick up and quite frustrating to try to work out exactly what the problem was. Whereas Hailey had the newborn screening, so she was picked up at birth and has since gone into an early intervention program, had been fitted with hearing aids and since cochlear implants, and is doing really well. She's age appropriate with her language and pretty much has no delays.
The pivotal issue here is that we need to identify these babies at birth so that we can get hearing aids or cochlear implants onto these children so that we know that their brains are able to develop like normal hearing children. Interestingly, a baby is able to hear from 20 weeks in utero, And so if a hearing impaired baby is born, we already know that they've missed out on 20 weeks of hearing in the womb, and therefore their brain has missed out on 20 weeks of auditory stimulation. As a result, the auditory part of the brain is not functioning as it normally should. So by putting hearing aids on the children as young age as possible, we're able to make sure that that brain is developing like a normal hearing child's brain, and therefore the child is able to develop normal and age-appropriate speech and language.
Our first daughter, Jenna, she's 5 years old. She was tested for hearing at birth, come back with no loss, where Shayla was tested at 1 day old, come back with a hearing loss. Within 5 weeks, she was fitted with hearing aids. We've got a normal little girl who's giggling, laughing, learning how to hear, learning how to speak. So, yeah, it's good.
You might be wondering how your baby's hearing will be screened. Screening's conducted when the baby's settled and quiet. Most babies sleep through the test, which only takes a couple of minutes. First, sensors are placed on your baby's skin on their forehead, nape and shoulder. Then small cups are placed over your baby's ears. Clicking sounds are then played through the ear cups. The response of your baby's hearing nerve is measured on each side. Your baby's response is then compared to a known normal response. The results are immediate and will be given to you on the day. If your baby needs further testing, your screener can help you with what to do next. I hope we've given you a better understanding of hearing loss. While it's invisible, it's also easily detectable with this simple, non-invasive screening test. 50% of babies with a hearing loss have no risk factors, so it is vital for all babies to be screened at birth. If your baby does have a hearing loss, their best chance to develop speech and language is with early detection. We wish you all the best as you welcome your baby into the world. Telethon Speech and Hearing Centre for Children is a non-profit organisation which offers a newborn hearing screening service in a network of private hospitals in Perth. Ask your hospital for a consent form today. For screening outside of Western Australia, please check with your state's health authorities.